Hi, my name is Isabella Lomax. This is my resubmit for video number 22 for calculating and administrating an injectable medication. So I'm just going to be going over a few things. So first of all, when drawing up medication from a multi-use file, which is anything like Medicam that is not single use, isn't disposed after one use, and will get continuously jabbed by a needle to draw up the medication, to remain as aseptic as possible, and to make sure that there's no cross-contamination going on. It's best practice when drawing up the medication prior, at least our practice in my clinic, is to grab an alcohol wipe and wipe the rubber casing before and after injecting the medication. Also when drawing up, if you go slower to draw up the medication, that will limit the bubbles that accumulate if you draw up. And then another thing that you can use, which we have for some of our multi-use files, this is a safety inject valve needleless adapter, so needleless, sorry. So you just pop the syringe top in there, obviously being sterile in both packets. You can wipe this one as well, but it also means that you can't, if you're using one syringe for two different types of medication, usually for pre-meds and things like that, you can't inject any of that medication into the other bottle. So is good for use with some things. We have this on our ProHeart as well, which can stop bacteria getting into the vial itself, which is also good. So that's also another option. So I've gone over that. So I've got my Medicam. So another thing is when going to the patient to give this to, you will be checking full signalment. So full signalment being species, canine or feline, weight of the animal, the breed, Labradoodle or domestic short hair for a feline patient, the colour, tortoiseshell, brown, whatever, any distinctive features that may be present. And you're also looking at the desexing status and sex, so male, female, desexed, neutered, everything like that, to just get the full picture, especially if you have a few animals in of the same breed, species. Make sure it is the correct animal, and then obviously looking at their cage chart, their name obviously, and any form of identification they have on them specifically. So Lomax, this is my resubmit for video 22. So I've injected the Medicam injection into my patient. So I'm also just going to be swiping the vial again after I have used it, so it's all ready to go. All of this will be going into general waste along with the syringe. But first of all, I'm going to be popping the sharps directly into the provided sharps container. I don't touch the sharps at all. We've got a specified container which can take the sharps off without you having to put your fingers anywhere near it. This will just go in general waste, and that is it.